Let's talk about sleep for a second. So everyone knows we need to get it. We sort of give it lip service, but I want to highlight some aspects of sleep maybe you're not thinking about. First of all, let's set two boundaries. I want you to think, as a human being, if I'm trying to be in survival mode, 7 hours is our minimum. We really try to feel strongly about that. That the best research in the world is, yes, you may be very special and get by on 7, but we know that 7 is sort of our minimum threshold for survivability. What I want you to understand, of course, is that if you have a busy life, or you have kids or a job, there'll be times when you go through your life without getting 7 hours of sleep and you're just fine. You'll have to make up for it. But in this situation, we're really trying to talk about insulin sensitivity, we're trying to talk about healing, we're trying to talk about all of the cascade of hormones that are released during sleep that helps us to repair and turn over these tissues, especially during surgery or post-surgery or around surgery. So the magic is anytime I have an athlete or a person who is trying to change their body composition, trying to heal, trying to grow, 8 hours is our magic number, which means, and keep in mind that all the data from all the trackables suggest that upwards of an hour of sleep disruption a night is typical. So if you want to get 7 hours of sleep, you need to be in bed for 8 hours. If you're trying to get 8 hours of sleep, you need to be in bed for 9 hours. And working appropriately to maximize your healing response. So that's what that's about. Now, a couple things though. All you have to do is, if you've never had a surgery, be prepared for disrupted sleep. And there were sort of two schools of thought around sort of the sleep disruption that happens. One is jump on a sleep medicine, try to sleep through the night, right? I want us to reframe our disrupted sleep because you're likely to have some chronic pain or some persistent pain, some breakthrough pain. It's going to be uncomfortable. You're going to move your limb. Something's going to happen. It's not going to be very good sleep. And let's, instead of worrying about that, let's go ahead and reframe that as a protection mechanism. That one of the reasons we're actually not a big fan of, taking massive amounts of pain meds so we can get through the night is that potentially one of the signals to move and fidget is to help decongest, to reload a tissue, to unload a tissue, to rechange positions. And if you're not getting those signals, you may miss that. So there's going to be absolutely some time where you're going to have disrupted sleep, but we'll make it up in naps, and don't worry about it. So this 7 or 8 can be total aggregation. So if you can get some little naps during the day, the idea here is initially when you're in your few days right after surgery, your sleep's going to be highly fragmented and you'll be fine. This is not going to put you in the hole. This is a long-term chronic issue of sleep deprivation where we're seeing people sort of, on the TV and being a little bit lazy. So we'll really can divide this into two periods. After I get through this initial sort of post-surgical experience, I'm really shooting for this big 8, in bed for 9. But initially, understand that it's totally okay to be up, totally okay to need to fidget, totally okay to have to walk around, totally okay to change position. It's just your body trying to protect you. It's asking you to move, it's asking you to fidget, and that pain is very much a protective mechanism. So I'm not saying go cold turkey and just, sweat the white hot beads all night, but I am saying that this pain is an important mechanism to keep you moving and decongesting. Now, we'll talk about the NMES devices in a bit, but those devices, those neuromuscular electric stim devices, allow us to get some movement into the system so that maybe we don't have to move and sort of deal with sort of this autogenic or me generating movement or changing position because the tissues are in constant sort of motion. But the bottom line here is, as we're trying to maximize our healing response, you have to begin to prioritize your sleep, especially after that initial phase where your sleep is going to be disrupted because you're trying to manage or protect or guard and you're very sensitized. Again, don't worry about that. Get the naps, do the best you can. And then once that starts to kind of calm down a little bit and we're into that kind of second week, even later half of the first week phase, you really, really want to prioritize your sleep. I'd also recommend, if you haven't ever used a tracker, this is a perfect time to kind of track sleep. Get on your sleep hygiene, which of course includes things like trying to eliminate alcohol because it's the sleep disruptive, making sure you maybe can get warm before you go to bed, sleeping in an eye mask, making sure the room is cool, those kinds of things, of course, which everyone knows around sleep hygiene can be very useful. Prioritize your sleep density, make it as good as you can get, do the best you can in this situation, but then as soon as you start to catch up after the surgery, get that 8.